Hello there, my name is Dr. Tim Rawson, and today I'm here to talk to you about enhanced, personalised and integrated care for infection management at the point of care, or EPiC IMPOC. EPiC IMPOC is an integrated web-based platform which aims to address the problem of antimicrobial resistance. Antimicrobials are commonly prescribed across the entire healthcare spectrum. And one of the leading drivers in the development of antimicrobial resistance is the inappropriate use of antibiotics. Antibiotic resistance is rising at an alarming rate, and if it's not checked, by the year 2050, it's estimated that up to 10 million people a year will die secondary to antimicrobial resistant infections. That's a greater number than cancer and road traffic accidents combined. In terms of antibiotic prescribing, we need to find ways of addressing the numerous outdated technologies and separate healthcare systems that obstruct the provision of high quality care. We currently collect and use data electronically within hospitals, but have no way of intelligently applying it to individual patients who often have very complex medical needs. This includes infections, which often don't happen in isolation. With an aging and more complex population being admitted to hospital, we need to find better ways of supporting decision-making around antimicrobial use, and thus addressing the problem of antimicrobial resistance. Our solution, EPiC IMPOC, is an artificial intelligence-based, integrated web platform which allows us to provide advanced and personalised decision support for antimicrobial prescribing at the point of care. It aims to utilise data from a range of different electronic sources across the hospital, apply artificial intelligence to these, and then provide recommendations for infection management to the individual clinician in front of the patient that they're actually managing at the time. The EPiC IMPOC system is a web-based application which allows data visualization, including individual patient variables, previous cases, pathology data, and microbiology data to be graphed and visually analysed by the clinician at the time of decision making. The algorithms running EPiC IMPOC collect over 50 variables from around the hospital and then apply these using two different types of artificial intelligence. One of those is case-based reasoning, and one of those is a supervised machine learning algorithm. The supervised machine learning algorithm, which is visualized in D6, is able to provide infection inference, recommending the likelihood of an infection being present and the potential site that an infection is also affecting the individual patient. The case-based reasoning algorithm then provides recommendations on the most likely antibiotics which will be successful for the individual patient. These can be scaled and changed based on the individual clinical parameters input by a physician during the clinical history and examination. The EPiC IMPOC system has already been successfully CE marked and has been integrated and piloted across 3 Northwest London hospitals within the NHS. It's been demonstrated to be able to provide personalised decision support for infection management. We've been able to demonstrate that using commonly available blood variables, which are automatically extracted by the system when a patient is admitted to hospital, we're able to provide accurate recommendations on whether or not the patient is likely to go on to develop an infection within the next 48 hours of hospital admission. We've also been able to demonstrate that the case-based reasoning algorithm is able to enhance the prescription of antimicrobials in the hospital. It's able to recommend narrower spectrum, but equally as effective antimicrobials compared to what current physicians are doing in practice. Thus, we hope this system will have the potential to reduce the propagation of antimicrobial resistance in the future, as well as provide economical benefits to the hospital by reducing things like antibiotic prescribing rates and length of stay due to prolonged courses of inappropriate antimicrobials. Thank you very much.